طلبتنا الأعزاء السلام عليكم. I'm Dr. Mayami Kadhim Yousif and I'm going to give you 3 lectures in clinical genetics. The first lecture is about mode of inheritance or pattern of inheritance of genetic disorders. The second is going to be about chromosomal abnormalities, whether in the structure or number of chromosomes. And the last one is about prenatal diagnosis and genetic counseling. So in the name of God, we will start our first lecture, patterns of inheritance. By the end of this lecture, you should be able to understand different modes of inheritance and genetic disorders, then to interpret a genetic pedigree. For more information, you can refer to Illustrated Textbook of Pediatrics or Nelson Textbook of Pediatrics. Before the lecture, this is a pretest, a simple pretest, self-assessment one. So please describe or write the diagnosis for each slide. In this slide, what kind of abnormality you can see? What is the diagnosis and what is the mode of inheritance of this condition or this disease? What you call this test and what is the benefit of doing it? What you call this lesion and what's its mode of inheritance? This is what we call the genetic pedigree. What pattern of inheritance does this trait follow? And what is the genotype of individual number 9? What abnormality is shown in this blood film? And what you call the condition involving the hands of this child? What is your diagnosis and what is the mode of inheritance of this disease? What pattern of inheritance is shown in this pedigree? Ali is a 7-year-old child who is unable to discriminate between colors. His maternal grandfather had the same problem. However, none of Ali's sisters has the same condition. What is the most likely mode of inheritance of this condition? Okay, let's start. Inheritance patterns trace the transmission of genetically encoded traits, conditions, or diseases to offspring. And there are several modes of inheritance. A genetic disease is inherited either as a single mutant gene, that's what we call Mendelian inheritance, or in non-Mendelian pattern which involve the mitochondrial and multifactorial inheritance. For the Mendelian type, we have autosomal dominant, autosomal recessive, X-linked recessive, X-linked dominant, and Y-linked. What we mean by autosomal? The gene responsible for the phenotype is located on one of the 22 pairs of autosomes, that is the non-sex determining chromosomes. When we say X-linked, we mean the gene that encodes for the trait is located on the X chromosome. And dominant means conditions that are manifest in heterozygous. Recessive involves conditions that are only manifest in individuals who have 2 copies of the mutant allele and they are homozygous. How to evaluate a genetic pedigree? First, see the transmission. Is it vertical or horizontal? In vertical pattern, affected family members are shown in every generation, while in horizontal pattern, the affected members are shown in only a single generation. Second, see the sex differences. What is the ratio of affected males to females? And third, the segregation. Is the disease or gene being passed through unaffected females that are the carriers? Is there male-to-male transmission? Then what percentage of children are affected? For example, all of sons but none of daughters? This pedigree illustrates the transmission of an autosomal dominant trait. And as we said, dominant conditions are expressed in individuals who have just one copy of the mutant allele. Now, what are the characteristics of autosomal dominant inheritance? First, vertical pattern, that is, multiple generations are affected. So the disease is shown in multiple generations. Then, sex differences, male and female equally likely to be affected because it is autosomal and non-sex linked. Then, see male to male transmission. This is very important, male to male transmission, because in X-linked there is no male to male transmission. And each child of unaffected individual has a 50% chance to be affected. So in each pregnancy, each child of unaffected individual has a 50% to be affected and 50% to be normal. Then, for every affected child should have unaffected parent. This is the recurrence risk in each pregnancy. So there is a 50% for the child to be normal and 50% to be affected. This is a case of achondroplasia. The child presented with short stature and short upper and lower limbs, and it is inherited as autosomal dominant. For many patients with autosomal dominant disorder, there is no history of unaffected family member. The patient may represent a new mutation, and we call this autosomal dominant with a new mutation. Now look at the pedigree. You can see autosomal dominant inheritance. The squares are fully shaded and there is male to male transmission. But in autosomal dominant inheritance, every child should have affected parent, but this is not the case in this pedigree. So the affected child underwent a new mutation. Autosomal dominant with incomplete penetrance. This is a special case of autosomal dominant inheritance. What we mean by incomplete penetrance? That is when the mutant gene is present in an individual, but it couldn't express itself in phenotypic manifestation. Look at the pedigree, which illustrates autosomal dominant inheritance. The male, the affected male and the affected female in generation 3 should have affected parent. This is the rule in autosomal dominant inheritance. But this is not the case in this slide or in this pedigree. So the father in generation 2 should have the mutant gene and he passed it to his son and his daughter, but this gene failed to express itself in phenotypic manifestation. That is why the father looks healthy. Now consider this pedigree, which illustrates an autosomal recessive inheritance. And remember that recessive conditions are clinically manifest only when an individual has 2 copies of the mutant allele. When just 1 copy of the mutant allele is present, the individual is called a carrier of the mutation, but does not develop the condition. What are the characteristics of this kind of inheritance? First, horizontal pattern. So see, only single generation affected. Then, males and females equally likely to be affected. Females and males are affected equally by the trait transmitted by autosomal recessive inheritance because the mutant alleles are not found on the X chromosomes. When 2 carriers mate, each child has a 25% chance of being homozygous, unaffected, and a 25% chance of being homozygous mutant, affected. and 50% chance of being heterozygous or unaffected carrier, and this is the probability in each pregnancy. And this is what we call the recurrence risk for condition inherited as autosomal recessive pattern. This slide indicates the recurrence risk of the disease in each pregnancy. Here, the capital A indicates normal allele, while the small a indicates a mutant allele. So in each pregnancy, there will be a 25% for the child to be normal unaffected, then 50% to be a carrier for the disease, and 25% or 1/4 to be affected or having the disease. This slide represents what we call pseudo-dominant inheritance, and this refers to the observation of apparent, not real, dominant, that's parent-to-child transmission of a non-autosomal recessive disorder. This occurs when a homozygous affected individual has a partner who is a heterozygous carrier, and this most likely occurs with sickle cell anemia and congenital deafness. How can we explain that? Just look at the pedigree. You can see affected individuals in all generations similar to that in autosomal dominant inheritance. But this should not be the case in autosomal recessive. We said the disease present in single generation. So why this happened? For this disease, or for diseases that are common in the community like sickle cell disease, you expect many individuals are affected in the family or being carriers. So when two cousins mate, if one of them is affected and the other is carrier, they will give affected children, and the pattern of inheritance will apparently look like autosomal dominant. This slide shows a child suffering from sickle cell disease. Sickle cell disease is a common disease in our community. Why diseases inherited as autosomal recessive are important? This is because they are preventable. We can prevent them. How? Just by keeping the carriers away. So our job as doctors to screen for carriers and to advise or even prevent them from getting married in order not to give children who will suffer lifelong. And this is the true love. So we have to tell the carrier to love his children before their birth and don't let them suffer. And if you know that you are a carrier for autosomal recessive disease, keep away from another carrier. And this is how the disease will end. Thalassemia is another disease inherited as autosomal recessive, and it is again common in our community. A child with phenylketonuria, and this is another example of diseases inherited as autosomal recessive. This is the neonatal screening test, and it is very useful to detect some harmful conditions so we can manage the infant very early to save him. This pedigree illustrates X-linked recessive inheritance. A carrier female can pass the disease to her son. What are the characteristics of this inheritance? First, males are more affected than females. That's because females have 2 copies of X chromosome. Then the affected males pass the gene to all of their daughters and none of their sons. There is no male-to-male transmission. Daughters of carriers, female, have a 50% chance to be unaffected, what we call carriers. The sons of carrier females have 50% chance to be affected. and affected males in the family are related to each other through carrier females. So, if a male child is affected, ask about his maternal uncle. If a healthy father mates to healthy mother but a carrier, so in each pregnancy there are 4 possibilities. First, a healthy son. Second, healthy daughter, non-carrier. Third, healthy daughter but carrier. And fourth, affected son. Hemophilia is an important example of diseases inherited as X-linked recessive. This pedigree shows X-linked dominant inheritance. In this pedigree, we can see that females are about twice as likely to be affected than males. And the disease may be lethal in males, but usually milder or variable in females. Affected males pass the gene to all of their daughters, who will be affected, and to none of their sons, because there is no male-to-male transmission. And sons and daughters of affected females have 50% chance of being affected, and this is similar to autosomal dominant. This slide shows retinitis pigmentosa, which can be transmitted as X-linked dominant. Here we have the Y-linked inheritance, in which only males are affected, of course. Affected males pass the disease gene to all their sons and to none of their daughters. This is another type of inheritance, the non-Mendelian inheritance, multifactorial inheritance. Most diseases have multifactorial inheritance patterns. And as the name implies, if we said multifactorial conditions, are not caused by a single gene, but rather are a result of interplay between genetic factors and environmental factors. Diseases with multifactorial inheritance are not genetically determined, but rather a genetic mutation may predispose an individual to the disease. The majority of diseases or conditions are inherited as multifactorial. These are a few examples: heart diseases, some cancers, neural tube defects, insulin-dependent diabetes mellitus, the intelligence, and many other conditions. This is the last type of inheritance, the mitochondrial inheritance. As you know, mitochondria are only inherited from the mother's egg because the sperm has no mitochondria. So only females can transmit the trait to offsprings. But however, they pass it on to all of their offsprings, males and females. The primary function of mitochondria, as you know, is conversion of molecule into usable energy. And for this reason, many diseases transmitted by mitochondrial inheritance affect organs with high energy use, such as the heart, skeletal muscle, liver, and kidneys. Here we have some condition inherited as mitochondrial inheritance. First, mitochondrial myopathy. Second, DAD, a combination of diabetes mellitus and deafness. Then a combination of mitochondrial myopathy, encephalopathy or encephalopathy as you like, lactic acidosis, and stroke-like syndrome. This slide shows mitochondrial inheritance. We can see the mother transmits the disease to all siblings, males and females, while the father cannot. So all the transmission of disease is through the mother, and all siblings are affected of both sex. This is an assignment for you. Question 1. What is the difference between a genetic disease or condition and a congenital disease? Question 2. Write two other conditions as examples of autosomal dominant inheritance. Question 3. In what condition a female may exhibit signs of X-linked trait? That's all. Thank you for listening and good luck.